anyone would like to come and sit, there's some seats at the front. You can move my mink. It is beautiful, but it doesn't need a seat for itself. So, okay, so ICW is very, very excited to be partnering with IAVI on this session where it is titled Women Setting the Agenda, a dialogue between HIV researchers and women living with HIV. This is going to be an interactive conversation. We are thrilled to have this robust panel of experts in a number of different regards here. And we think that, moving forward, women living with HIV have been left out of the dialogue and conversations on research. And we're a little bit sick of research being done on us and not being part of the process. So we are here to talk to, as women living with HIV and researchers, about how we can work better together to ensure that the needs of women living with HIV are actually at the forefront of research. So we have a lovely panel that I'm going to have introduce themselves and where they are from and who their affiliations are.
Hi, can you hear me? Okay. Hello, everyone. My name is Rebecca, and I'm from Fiji, and I am part of ICW Asia Pacific.
Good morning. Is it still morning? I am Deloris Dockrey, and I'm with ICW North America.
Hello, I'm Sindi. I'm from Indonesia, and I'm with ICW, all ICW.
My name is Prince Bahati. I work with the International AIDS Vaccine Initiative. I'm based in Nairobi, but I'll have to add, I am ICW.
So we are all ICW up here, and for those of you who don't know, that's the International Community of Women Living with HIV. We're the only for and by global network, which makes us very special and unique. And it puts us in a unique place to really be the ones that researchers should want to work with in order to do research. So first of all, I'm going to go around the table and talk about why. My first question is, why is it important for researchers to work with women living with HIV?
I think one of the very important reasons why researchers should work with women who are living with HIV is because when you want to speak about issues that surround or involve women living with HIV, it's got to include them, the women themselves. And secondly, well, most importantly is that when you're addressing issues on women who are living with HIV, and if there are issues in regards to violence or gender-based violence, you've got to have you've got to hear their voices. You've got to hear their issues. You've got to hear what they have to say to actually know that, all right, this is how we are going to address these issues. And it's also about data, and it's also about collating and ensuring that the response from the women are really good to ensure that their issues can be addressed at the end of it all.
And I definitely agree with Rebecca. I think that why researchers need to work with us is that women are different across the spectrum. There are many aspects of our life that need to be researched. When you look at gender violence, we need to look at how young people experience violence versus how older people, like myself, experience violence and the realities of our lives. It's very different. And I think you have to come to the folks to really learn that. So there are two kinds of data that can be collected, qualitative about what our lived experiences are, and use that to inform other quantitative data that is being collected I don't think that there is enough data collected on how violence really impact the life of women living with HIV. When you look at surveillance data, they talk about the number of women who are living with HIV, but they do not often talk about the experiences of those women and how it impacts them. And that's where research is needed. And I think a network such, I know that the international community of women living with HIV, a network of women, can inform research and can help researchers to better reflect what is happening in our lived experience and collect data around that.
I agree with Rebecca and Deloris. And because we, women living with HIV, is working in the ground, so we know what exactly happened. So by working together between the researchers and women living with HIV, our hope is the needs and the needs of the needs of women living with HIV can be addressed in the research field.
So first of all, thank you very much for inviting IAVI to be part of this panel discussion. It's a really great opportunity for us to have a partner in ICW that has demonstrated actually that they can lead the agenda, and there is a track record of not only just the community engagement, but also really guiding the agenda on what is needed for women and women living with HIV. Why should we work with researchers? First of all, before we become women living with HIV, we are women. And women and men are different. And I think we are all tired of looking at research as if men and women are the same. I think there are so many differences, whether they be biological or social or structural issues that affect men and women differently. And I think it's very important as we design and we implement research that these differences are included. Secondly, I think it's very important that we acknowledge the leadership of women who are scientists that can actually bring some of these issues to the platform. And I think ICW has the network and the influence to bring some of the women scientists who actually need to be spearheading some of these critical issues, because the field of science, unfortunately, is dominated by the same old male and not having really the female scientists driving some of these agendas. So I think engaging women living with HIV will bring to the front not only the issues that most of the other predecessors have talked about, but it will also put forward some of these gender imbalances between the scientific community so that we can have women who will drive the agenda. And thirdly, for me, I think it's about translating research into practice. Even when we do all these things and engage women into the design and the implementation of the research, at the end of the day, it's networks like ICW and women's organizations that have shown to the leadership in translating research into real practice. So to me, there is no way that we can continue doing business as usual. I think this is the right opportunity to start engaging and meaningfully engaging women living with HIV, but also women across all the different spectrum. My colleague Deloris talked about old, young, rural, urban, north, south, because this is the only way that women are not going to be left behind. And so far, I'm sorry, it seems like if you look at the number of women participating in research, we are left behind. If you look at funding on women's organizations to implement research outcome, we are left behind. So I think this is really the time for us to set up the pace and really get into the race.
Thank you. Do you just want to, for a moment, because ICW has been talking, and we're kind of, people know ICW in this space, but they may not know IAVI. So maybe do you just want to take like a minute to explain IAVI and the work that you do?
The International AIDS Vaccine is an international organization which has the mandate of looking at a safe, preventive, and accessible HIV vaccine. And the way we do it is we do it with the community, for the community, and really not leaving anybody behind. So we are internationally based. We work with our partners, our community, but also different scientific partners to bring to the forefront an HIV vaccine that we do believe is going to be one of those critical tools into the combination prevention to get us and sustain ending HIV/AIDS. But I have to say, we are not just focusing on HIV vaccine when it comes to people. We are also doing partnerships with other research organizations that are working on pre-exposure prophylaxis, are working on treatment as prevention, are working on cure, because we do believe this is really a time for us to come together and really pushing the agenda of ending HIV/AIDS, but with the community of people living with HIV. And for us, it's really critical, again, that women living with HIV and AIDS are part of this process. So thank you very much.
Am I working? So I just want to do a bit of an interactive part. Who here has been involved as a research subject before? Filled out a survey, been part of a clinical trial, filled out, yeah, there's some of us here. Who here has been a peer research assistant? Oh, a few less. Who here has led a research project? Oh, of course, the man. Oh, two. No, I'm just seeing who we have in the room as well. So I think something interesting, and one thing we wanted to do with this panel is to hear from the women, what kind of research would you like to have done, especially when it comes to treatment and that more like the hard sciences, but of course they interact with the social science elements. I myself would be very interested in having medications that have side effects that would lessen the side effects, that would stop making internally and externally my body's shape change in ways that are not comfortable. We had a lot of conversations with women living with HIV that were really concerned about not feeling part of their body anymore, and really wishing that the HIV medications would not make them lose their bums in some cases, redistribute fat to other places, make you look pregnant in less than 2 months. That would be my dream, to not be scared to change medications due to the horrible side effects on women. Anyone?
So I love the work that IAVI have been doing around identifying a vaccine, whether that be a treatment vaccine or a preventative vaccine. But I just can't believe that we have not been able to bring to market a microbicide, something that women can use without negotiating. No matter what condom is on the market, whether it be male or female condom, we have to negotiate condom use. And we have to talk about it, and we have to hope that our partners are willing to participate and all of that. Why can't we have a microbicide that we can just use conveniently to protect ourselves? So for me, that is the important thing.
For me, I wish to have less medication of less effect medication ARV for women living with HIV, because if I'm talking about women living with HIV, especially and in my organization also, we do some focus group discussion with not only with women, but all people living with HIV. But from women self who already known their status of HIV, they afraid to take medication because of the side effect of ARV. So it is very, very huge dream, I think, for all women living with HIV to have less side effect ARV, because of course we don't want that woman living with HIV because now we already have ARV, but they afraid to take ARV just because the side effect. They afraid.
I think I'd agree with Jess in how she said, you know, women love their body. I mean, it is about the only most precious thing that they hold very close to themselves. So when ARV comes into a woman's life, it sort of disfigures a woman's body. Your breasts become way too big, and you don't have any backsides, and your stomachs just actually hang out, and it's just not fair, because we still have to continue to take the treatment. Yes, it's not helping our body. Even when we exercise, sometimes your breasts may still just stand out too far, and it just becomes very uncomfortable. A drug that would actually assist or help in a woman maintaining her health and her figure and her body would be the best, especially if it has to do with ARV. That is a woman's life.
Yeah, I heard one of the women the other day say that, you know, they wish that their ARVs could be put, or microherbicides could be put in some chocolate that we could eat. That's one thing that we'd like researched. What are some of the barriers to women being involved in research? What about young people? What are barriers to young people being involved in research? We can take it from the audience. We can freestyle. This is interactive.
Well, I was part of some research, but I was very young. So I think that being adolescent was a barrier because my opinion wasn't taken in account. Um, so I think that was the biggest barrier. And about afraid of taking the ARVs, one of the things that I'm afraid of, I was born with HIV, so I'm young now. So I don't know what will happen in 5 years, 10 years. So that kind of research about what happened after more than 20 years living with HIV and being born with HIV, I actually don't know if there are enough research on that, because I don't know if the way I'm feeling now, I'm supposed to feel this way, because I have never been living without HIV, so I don't know if I'm supposed to feel like this, or I don't know. So I think that.
And do you have to get consent from your parents to be in these trials? Is that a barrier if you wanted to be?
Yes.
Well, I think age is definitely a barrier. I think some of the things that we are learning now through the time is that you still have many countries that do not have any guidelines on what exact time should young people, especially the young adolescents. I think the age limit in most countries set at 18. So it's excluding young people to get into the research agenda. Unfortunately, all the data that we have indicates that young people start sexual activities early, and it's really upsetting to still have some communities where they're still allowing young people to get married at 13 and they cannot allow them to access sexual and reproductive health services at the age of 13 and they put it at 18. So I think it's kind of a hypocrisy in the way some of these societies treats the young people. So I think it's an ongoing conversations. I know South Africa has had conversations with the ethics, with the scientists, and I think their age, they have some guidelines on which age group now can start being introduced into clinical trials. It has some ethical considerations. There may be areas where parents may have to consent for participation or assent for participation, but other areas where the young person will be able to enjoy that confidentiality of participation. Absolutely. Yeah. So it's sometimes parents may want to, yeah. So I think that's a very important point. I think that those are some of the ethics that we have to look at. Sometimes parents may want you to participate in clinical trials, but you don't want to participate. And in most of the processes of engaging young adolescents into clinical trials, they still have to find out if you're willing to participate in clinical trials. I think your last word is what matters. But unfortunately, there are no guidelines to guide this kind of process, so you find abuse here and there. And I think what we are trying to do as IAVI is we are having these consultative meetings in Kenya, Nigeria, and other countries soon to start having these conversations about how do you create a good environment for young people to participate in clinical trials and young people living with HIV to participate in clinical trials and still respect their autonomy, their integrity, but also integrating them in setting the research agenda. Because, you know, like most people here are talking, some of these research needs are not getting to the researchers. And sometimes it's a researcher sitting down and, you know, like thinking about a good scientific problem, because we needed ARVs. I know how we went to the streets and we really wanted to get ARVs. But did they think about all these issues about how it's going to affect the body?
Yeah.
You know? So for microbicides, whether it's rectal or vaginal, are we thinking about the importance of the body and the effect that it's going to affect the body? For vaccines, are we thinking how it's going to affect men and women differently? I think we are learning through this process, and I think that's why we are saying this is the right time, that as we sit down and we move forward with research, that they're not just coming and presenting to us, oh, this is the efficacy that it is. But let's also think about these gender issues, these biological differences, so that as we are moving forward, we are having science that is integrating the needs of women.
There is a long queue now that wants to talk about the barriers. So we're going to go with Rebecca, and then we'll go Daisy, Naro, Rebecca. Oh, man. Okay, so, all right.
Thank you. Another one of the big barriers is culture, especially when you're involving peers, when you're involving people who are living with HIV in any research, as peer researchers or as any such thing. When there are male and female involved, the female really, their voices are not strongly heard in that platform, because male want it generalized, because some male do know how fragile or how fragile women are, and our issues, there are a lot, and when we raise it, it will be something that needs specific attention and addressing. So these are very, and when I say, why I say culture is because in the Pacific, most Pacific Island countries, women have very little to no say. Men are dominant. I know it happens all around, but in Fiji, it's becoming better. But in other Pacific Island countries, it's very poor. We have most of our positive people living with HIV who are advocates, who are women. But as soon as they see their leaders, or as soon as most of their colleagues are all male, so where does the women issue get raised there? And that's why I'm saying this is one of the biggest barriers. Thank you.
I want to highlight two barriers. One on the researcher side, maybe the reason that I can think of women living with HIV not being able to become a researcher or not fully participating in a full as a full-time researcher, or not many of the women living with HIV are able to assist any researcher, is due to the literacy level also, because the literacy level of the women are very low in our region. Secondly, the respondent of women living with HIV, I have found out that it's very difficult because of the language barriers, because the research is mostly in English, and if it's a big funded research, like for example WHO or Global Fund big research, then the language are translated into the UN languages, 6-7 UN languages only, which is not possible. For example, let's take India. Of course, Hindi is there, but we don't speak Hindi. We don't understand Hindi. From the northeast part, it's impossible to do the survey or to respond to it. So I think resources should be made available to cover this language, to cover these language barriers. For example, if it's targeted to the women at the grassroots level, and I think what we all want to know is the real issue coming from the grassroots level, then the language, it should be looked upon, it should be taken care of, it should be translated into the local language that those women at that community is using, and there should be resources available to do that, so that everyone is able to participate. Thank you.
Daisy?
I just want to mention that barrier part only. One is disclosure, as because of this adolescent girl, child, and youth, and honestly, in culture, in interior sectors, they might have disclosing their status is very late. That's the one thing. And mother to daughter, parents to daughter also disclosing is very late. And second barrier is cultural in taboos in rural areas. And India, like developing countries, women will not able to come out. They are not allowed to come out because of culturals. That too, talking about HIV and research-oriented things, they will not say. Even they will not show that of HIV. And that's the thing. And number 3 is like not really feeling free to come out and talk about HIV. Because of the fear. And these are the things. SRHR is now only for past 3 years, we are, after these 3 decades, women, even like menopause and all, age factor also. For 50, 45 age HIV positive men will not able to talk about their menopause freely. They will not able to access that, the uterus part and all. So it's fear and things like that. Thank you.
Okay, go. And then Rebecca's in queue.
In my experience, the barrier for research between researchers and then the woman living with HIV is the lack of knowledge between researcher and then the woman living with HIV. And then, so like Naro said, usually the research using a very, very high language, and then we just use a very common language. And then sometimes what I feel, the research with a very expertise cannot make them simplify with the woman living with HIV. So it has become a barrier for us to involve all the process in the research.
Hi. When I was a young woman living with HIV, I participated in research activities and I never had access. I never saw those researchers again. I never got feedback. I often didn't hear what happened with that research. And now, 20 years later, as a mature woman living with HIV, I am very reluctant to participate in research unless I can have access to that research and know what happens. So I think that that is definitely one barrier that women are talking about too.
I think another barrier for a lot of women becoming involved in research is that the focus seemed to be totally on the disease and not on the impact on the woman's body. So women often are very concerned about how will this affect my ability to give birth, or to how will this affect my fertility? They have a lot of questions around that. And even when you talk about PrEP, those are the questions that are raised by young women. In New Jersey, where I am, we had focus group with HIV negative women around PrEP, and that was their primary focus. Like, will this affect fertility? Will this affect my ability to have children? And so even when you look at HIV positive women, those are still questions that remain unanswered. So I think that research have to do more about looking and collecting data about impact on women's body as a whole.
Hello? Okay. Who knew this was going to turn into a giant focus group? Yeah. No, but it's amazing how interactive this is, because I think that a lot of times women living with HIV are not really asked questions about what kind of research and some of their concerns, and it's just really amazing to hear from you all. And I think, why do you think, Prince, that there's not more consultation with the community? Is it educational levels, like the speed that researchers work? I don't know, because researchers do talk a different language depending on what their background is, whether it's biomedical or in the social sciences. But what are some of the barriers or concerns for researchers?
So first of all, I'm guilty as charged as a man and working in research here. I think there's so many things that need to be improved, and I think all these barriers that we all talked about are true barriers, and I think we have to acknowledge that we've not done better and we need to do better. So I think, to me, there are some barriers like cultural, educational, and the differences of power between researchers and community that are very structural issues that we all need to put our heads together. And I think this is what we are trying to do with ICW. It's never too late. It's bringing a little bit more of a way that we can educate, first of all, women living with HIV, and bring them a little bit up to speed with their research. But at the same time, going to the research community and bring them a little bit up to speed with community issues. I have to say, some of them are really passionate about what they do, and they're willing to learn community. We are the community. It's a science. It's not just community. We know how to work with the community. So they need to learn also and get a little bit more down. And I think this partnership with ICW is trying to do just that. How do we work with the researchers so that they can understand women's needs? How do we work with them so that they can understand community needs? How do we work with them so that they can understand the language and how to bridge that barrier? But we have also to do that with our own community to get to that point where we are talking as equals and not subjects of research. And I think that's really the mindset that we need to change. And this has been going on for a while. It's going to take some time, but we are committed as an organization to work with women living with HIV and other organizations to move that agenda forward. So, like as many other contexts, we need to encourage ourselves to go beyond some of those past experiences, because I know all of us here, we've talked about some experiences with research that may make us like, I don't want to do this again. But it's a process. We can't let the new generation down. We have to do it now so that those experiences don't happen. But it's got to be a partnership and an alliance with some of the women researchers that are already part of this process. I think sometimes it's very difficult to break into this social cycle that, biomedical are the priorities, the funders only fund the biomedical component and they forget about that biological and the need of women. So how do we make a social movement around this to educate both the scientific community the funders so that they're also interested in this kind of approach. And it's got to take us to do that. So there may be a various way and reasons for why these things have not happened, but they're not good reasons. We can't let that to continue to happen. And it's a coalition of all of us. And not leaving young women born with HIV behind, not leaving the lesbian behind, not leaving even the young gay community behind, and men who have sex with men that also face the same stigmatization. So I think it's going to be a concerted effort for all of us to try to change the paradigm. And I think we have a confidence that all of us here with this kind of passion, we're going to make it happen.
Yay. So that's great. That's great. I wanted to, because we were kind of talking about some barriers and a little bit more of the negative aspect of research, but does anyone have any positive experiences with research? A researcher, because I think that it might be good to share a positive interaction that you had where working with researcher to do some work. Daisy has something?
Before, what you are asking is very, very important question. Before, I would like to ask that, of course, brother is telling that that it's everybody is focusing treatment, medicine, research like that. But our women issues in rural setup, interiorly, what we are facing, biological or mental and emotional issues, it's only they are focusing to stigma. No, it is ultimately it's focused to the treatment, and it is life saving. Women more, they are dying. But interiorly, if you are going as because they're putting everything in the broad jargon, the stigma and discriminations. But each emotional barriers from the houses and in their neighbors and localities and physical and emotional, everything focusing, not they can go for their proper medications and finally it will be end up to their mortality, this one only. This I want to say. Involving the community women and in their research part. And of course, we long back 3-4 years back, like human rights and issues in India, we have involved fully to collect all the data and focus group discussions positively because we know what is the issues, how can we can go with them, and how can we can tap that informations, and very, very comfortably we can do positive women they can do, and they can give this very good outcome and what is happening in that. And we had a successful research on human rights and violation of the women living with HIV and things like that. Thank you.
No, that's true. Positive women are able to have those discussions at a peer-based level that other researchers might not be able to have. And working with peers, you're able to get to the root of issues and a lot of different data that can actually touches the issues. So thank you. Good point, Daisy. Was there any good experiences of working with researchers? Okay. Do you have one?
Actually, it is not. In my country, it's starting to have strategic use of ARV. It started in 2013 last year. So they have their own research related on this, but it is very, very difficult language, and then to understand about the language, and then to have more feedback from the community. We asking to the government and also the research or the consultant of in the strategic use ARV to doing a research or M&E related on strategic use ARV, and then we make with a better language, which community can be more understand about this. And then after we got many feedback from the community about the strategic use ARV, So now we are in the process in analysis of the strategy of our research, and we got that the researchers give us support to us to have also analysis from us and also from them, and then it can be combined. So the program would be great.
Great. So working together, community-based research and researchers helping you to get funding and support for your organization. Amazing.
And just, I guess, on a community level, I am a HIV positive woman from Victoria, Melbourne, and I've been involved in a lot of different research, surveys, stuff like that. And the broadness of people that have come to do this research has been amazing. Publications from Melbourne University, they're going right up to different AIDS organisations. So I guess we're really lucky that I feel that our communities are being listened to. And yeah, I feel like our message is getting through to the researchers. So yeah, I think it's just more just sticking to the community, finding the key populations and working with them. It's working in Victoria, so.
And I have to say, I think research has involved community in many different ways. I think we have to acknowledge there's been a lot that has happened despite all the challenges. I think we have treatment now.
Treatment.
It's really amazing. We have to continue listening to the community then to improve treatments, to come up with chocolates treatment and many other ways.
Chocolates with microbicides in it.
Chocolate, microbicides.
That's what IAVI is working on. Just joking. Just joking.
Yeah.
In the next 10 years.
Vaccine with microbicides and combined. But I think, again, just to emphasize, I think the need of listening to women's voices, especially from the microbicides, from other women's movements, has really made researchers to start thinking about products that are not just about HIV, but also contraception. So these multi-purpose prevention technologies, or things that you can take as ARV but can also help you as contraception. I think there are some good conversations that have happened that are really taking into account the needs of women, but we need to do a little bit more. We need to be at the forefront. We need to engage better. We need to be part of the discussions from the design up to the implementation, and ensuring access and dissemination is done with and by women.
Great, great. And just to put you in the hot seat a little bit, so what is IAVI's doing, and what is IAVI's commitment to women living with HIV moving forward as key partners who are amazing? And I definitely have a crush on Prince. It's public now. And what lots of us. And tell us about how IAVI would like to commit to working with women living with HIV moving forward.
So as if this seat was not hot enough, putting me into a hotter seat. But honestly, I am ICW. I'm here because my sister died of HIV. I've had many of my relatives raped, and I've faced the cruelty of what an imbalanced world dominated by men can do. So at a personal level, for me, this is non-negotiable. We are in this together. We're going to end this together. As part of my organization, I think there is a strong commitment. We want to have a true partnership that is not just about having meetings, but about really all of us being accountable to moving this agenda forward. I think we have to have this kind of conversation with women at the global level, but we will have to have this also with women who are in my country, where women are raped every day. They need to be involved. So it's really a partnership that we are conversant that is going to engage the global conversations, but it also has to go out up to the grassroots level. So we are in this with you. We're gonna work with this together, but we also are conversant also with your commitment to working with us. I think, like any partnership, we all have to hold each other accountable. But with your track record, honestly, we are here because women living with HIV stood up to the injustice. And you have a track record that nobody else, not any other organization, can claim to speak on behalf of women living with HIV. So this is a partnership that is going to last, and I'm enjoying the ride. I'm going to enjoy the ride.
You just like how we all have crushes on you. No, but thank you so much for being here, and thank you for your very honest and heartfelt reasoning. Deloris has something. I was going to ask all the panelists to just, we're going to come to a close, so if they could just share their final thoughts. Then, of course, it's me.
Yeah, but, not to put you on the spot, but...
Back to the spot.
Yeah.
We're like, we love you, but hold on.
We know how this works. So I want to know, when will there be a task force that invites us to the table, that help us in your planning and development and how, what tool of involvement can we look forward to? And I don't expect you to answer now, but that's the problem a lot of times, is that people say, we'll involve you, you'll be a part of it. We might get a survey and we complete it, but that's not what we are asking for. We are asking for real involvement. What's that task force? When are you going to call us? When are we going to meet? Where are we going to meet? And what resources will be put in place for us to have meaningful involvement? And as I said, you don't have to answer, but that's what we're looking for.
I have to answer that because honestly, that's what we are all looking for. I think that whole spot is to Jessica, because I think we have a grant now, and that grant is definitely going to do that. How do we bring people to the table? How do we do this training? So Jessica, this is a hot spot for you. I think for us, we are committing resources. And we are committing our time.
No, but this is what I was going to close on, which is really exciting. So ICW and IAVI have just formed a new partnership, and we are going to be looking at training women living with HIV and developing their ability to understand research and be part of it. We're also going to do a convening with women living with HIV and researchers. I'd say similar like this, but we're going to get way more researchers at the table, and we're going to move forward, and we're going to set the research agenda and have women living with HIV be at the forefront of that. And I think that we're really, really excited. So we're going to start this partnership and pilot this idea in Eastern Africa with the team, with Lillian Hi, Lillian. It's nice to be called out when you're out there. But anyway, we're going to do it, but then this will definitely move on to other regions, and we are going to make, once again, a strong research agenda for women and try to overturn some of the wrongs that have been done when it comes to research to women living with HIV. So once again, I want to thank everyone for being here. Prince is amazing. And let's hear for Prince.
Thank you.
And the rest of the panel. Yay.
May I just say thank you very much. This is a great opportunity, but let me just remind ourselves, I think it's not about one organization. I think we have to bring every other organization to the front.
Yes.
Yeah, so I think this is a partnership that can start with one, but I think we'll have to building on this to bring other people on board to advance our common agenda.
Yeah, we are stronger together.
And
Go.
And another thing is, for women living with HIV, even we don't have enough knowledge about research, I think it's very important to be brave to come and then to do that research. Even like me, I don't know anything about research, but if this is very useful for our community, why not?
Yay! All right. So once again, thank you very much for being here. You've tuned into Women Setting the Agenda, a dialogue between HIV researchers and women living with HIV. And we want to thank you all for being active participants.